I've heard that root canals are very painful. Is that true? Hello, I'm Dr. Eck, if you haven't seen one of these videos. I'm a comprehensively trained general dentist, and I'm going to answer this question from a patient. So, are root canals very painful? A root canal itself is actually not a painful process. It's one of the biggest misconceptions, and I hear it from almost every person who needs a root canal, that they have heard that it's going to be very painful. And I remember myself before going through all of the dental training thinking that root canals must be the big torture in the dental office. Fortunately, it's the exact opposite. A root canal actually treats the source of the pain. Where most people associate pain with root canals, it's due to the pain that they were feeling from an infection, which gets severe enough to require us to do a root canal. And that's where the misconception arises. A root canal is a procedure usually done by a specialist. In most offices, they need to refer these out. In our office, of course, we cover all the specialties in-house. But a root canal completed by a specialist removes the source of the infection, which is inside of our teeth. Once you've treated a tooth with a root canal, the source of the infection is gone and the tooth will heal itself on its own, and you can actually keep a tooth even though the inner core of the tooth would have been infected without intervention. How long does it take to recover from a root canal? A root canal in most cases brings immediate relief. There are some cases where you will continue to experience pain, and there are ways to manage that pain, but it's good to be aware that you can have some pain. But as I've said, it will resolve on its own once the source of the infection is removed. And what you can do to manage the pain is to follow a strict prescribed medication pain management program that your doctor will recommend to you. And that's really the best thing to do. This way you save a tooth rather than needing to completely take it out to remove the infection. Now, some people wonder, how do you know if your tooth really needs a root canal compared to just needing a simple filling? The biggest difference between a filling and a root canal is how deep has it entered the inner part of the tooth. Then you would know whether it needs a root canal treatment or just a simple filling. You'll notice things if it gets into the inner part of the tooth. Sometimes it presents as a severe sensitivity to temperature. Other times it's pain to touch or biting, or there can be swelling. Our office is equipped with advanced imaging so that we can check and confirm exactly what treatment is needed on a tooth and give the appropriate amount of treatment. I really want to save a tooth if I ever possibly can, and so if it needs a filling, we always try that first, and if not, then we proceed to a root canal to be safer. A good thing to keep in mind is that the flip side of any root canal is that a tooth may be so far gone that it needs an extraction, and unfortunately I would say that that's really the more common scenario, that somebody couldn't get to the dentist, or they were too scared to go to the dentist, or for some other reason they waited until the tooth had caused them so much pain that they couldn't wait anymore. And at that point, many times the tooth actually can't be saved with the root canal because there's not enough tooth structure left. I can't emphasize enough how a root canal really can save your tooth and protect you from losing a tooth, and protects your entire mouth. Your whole mouth, you need to think of it like a full bridge of teeth. You can keep chewing if you don't have one of the supports in your mouth, one of these teeth, but if you remove one, the rest of them are taking on more force and are much more likely to break or have issues later. So I try to save every tooth that I possibly can. Thank you for watching the video. If you have any other questions, you can feel free to ask them and reach out. And if you know anyone who you think would benefit from watching the video, feel free to share. And thanks again for watching.